Seniors, if you're taking a vitamin D3K2 combo pill, there are 6 mistakes you need to avoid. We'll start with mistake number 6 and work our way to mistake number 1, the most critical. Quick disclaimer, this video is for educational purposes only and is not a substitute for medical advice. Let's begin. Mistake number 6, not taking your D3K2 combo pill with fat. This one sounds simple, but it makes a big difference, especially for seniors. Both vitamin D3 and K2 are fat-soluble, which means your body absorbs them best when there's some fat in your stomach. Take your combo pill on an empty stomach, or with just a light breakfast like toast or tea, and your body may absorb significantly less. That's almost like taking part of your dose and throwing it away. As we age, nutrient absorption naturally declines, so even taking a supplement faithfully may not deliver the benefits you expect. Over time, poor absorption can reduce support for bones, heart, and arteries. Research from the Cleveland Clinic explains why. Fat-soluble vitamins like D3 and K2 require dietary fats for proper absorption. Without enough fat, the vitamins may only be partially absorbed, which can meaningfully reduce their effectiveness. When absorption is low, calcium guidance to bones and teeth may be less efficient, and more calcium can remain in circulation, which has been associated with potential effects on arteries and kidneys over time. So what's the fix? Take your combo pill with a meal that contains healthy fats. It doesn't have to be huge. A handful of nuts, some avocado, eggs, a piece of salmon, or even a drizzle of olive oil works perfectly. The fats act like a delivery system, helping your vitamins reach the bloodstream and do their job. Even small meals with healthy fats can make a big difference for seniors, helping D3 and K2 better support bones and heart health. Think of it like watering a plant. You can pour water on the soil, but if the soil is dry and hard, much of it just runs off. Adding the right conditions, healthy fats, helps ensure your vitamins are absorbed and able to benefit your body. Mistake number 5, neglecting magnesium when taking D3, K2 combo pills. Many seniors focus only on the D3 and K2 in their combo pills, overlooking magnesium, the essential cofactor required to activate and metabolize vitamin D in the body. Without adequate magnesium, high-dose D3 may be less efficiently converted to its active form, limiting calcium absorption for bones and potentially leading to imbalances where calcium isn't directed effectively, even with K2 present. A key review published in the Journal of the American Osteopathic Association found that vitamin D activity may be reduced when magnesium levels are low, a concern for many Americans with low magnesium levels. This issue is particularly relevant for seniors, who often have reduced absorption due to age, diet, or medications, and where high D3 supplementation can further deplete magnesium stores over time. The fix: aim to meet daily magnesium needs through food sources like nuts, seeds, spinach, and whole grains, or, when appropriate, a well-absorbed supplement such as magnesium glycinate, which is gentle on digestion and supports vitamin D metabolism effectively. General guidelines for adults often fall in the 300 to 420 milligrams daily range, though individual needs can vary. This approach supports vitamin D activity, helps K2 guide calcium toward bones and teeth, and contributes to bone density, muscle function, heart rhythm, and overall mineral balance. Mistake number 4, taking your combo pill without a blood test. Many people begin taking a D3K2 combo pill, sometimes at higher doses, without first checking their vitamin D levels with a simple blood test. This matters because vitamin D levels can vary widely between individuals and can change over time. For seniors, this variability is even more pronounced due to reduced sun exposure, dietary changes, and age-related declines in absorption. Checking vitamin D levels before starting supplementation and periodically afterward provides valuable context, especially when vitamin D is taken at higher amounts over extended periods. Monitoring helps ensure levels remain within a range that supports health without drifting too low or too high. Supporting evidence comes from a Mayo Clinic study that analyzed trends in elevated vitamin D levels over a 10-year period. The researchers found that most cases of very high vitamin D levels, sometimes associated with hypercalcemia, were linked to prolonged higher dose supplementation without monitoring. As a result, they emphasized the importance of checking vitamin D and calcium levels when vitamin D is taken consistently at higher amounts, helping reduce the risk of potential issues. For seniors, skipping testing can mean missing meaningful benefits or unintentionally increasing strain on bones, heart, and kidneys. Without a blood test, you could continue supplementing when your levels are already sufficient, offering little added benefit while increasing the chance of imbalance. Or you could remain deficient despite supplementing, missing out on the support your body actually needs. Mistake number 3, using high D3 and low K2 combo pills. Most people think their D3+K2 combo pill is protecting their bones, but here's a hidden risk. If the D3 is high and the K2 is too low, calcium can sometimes end up in the wrong places. That means it may circulate in the blood, rather than being directed into bones and teeth, potentially increasing long-term health risks. Many senior-targeted D3+K2 combo pills provide 5,000 or even 10,000 IU of D3, while including only a small amount of K2, sometimes as little as 45 micrograms. Some people even take extra D3 on top of a combo pill, thinking more is better. Research referenced by the National Institutes of Health explains why this matters. Vitamin D increases calcium absorption, while vitamin K activates proteins that help move calcium into bone tissue. When K2 is insufficient, those proteins may not work optimally, so calcium can sometimes end up in soft tissues rather than bones, potentially affecting arteries and kidneys. The risk can increase with age. Bone density naturally declines and blood vessels lose flexibility. Poorly balanced D3+K2 combo pills can contribute to both issues, even when taken with good intentions. The solution isn't avoiding combo pills, but choosing ones where D3 and K2 are properly balanced. As a general guideline, many experts suggest that for higher dose D3 supplementation, a proportionate amount of K2, such as around 100 micrograms per 5,000 IU of D3, can help guide calcium into bones and teeth safely. This is illustrative, and individual needs may vary. Mistake number 2, choosing the wrong form of K2 in your combo pill. Not all vitamin K2 is created equal, and many combo pills cut corners. Some use MK4, which has a very short half-life, or sometimes just K1 from leafy greens. While these forms provide some benefit, they aren't always the most effective at directing calcium where it belongs, into your bones and teeth, and away from soft tissues. Research from the National Institutes of Health shows that MK7, the form of K2 found in fermented foods like natto, has a longer half-life and may be absorbed more effectively than shorter forms like MK4. MK7 stays active in the body for days instead of just hours, providing more consistent guidance for calcium. So what's the fix? Check your supplement label carefully. Look for MK7, which is often found in the range of 100 to 200 micrograms per day in combo pills. This range is a helpful guideline for supporting steady calcium guidance, particularly for seniors, but individual needs may vary. Mistake number 1, ignoring drug interactions, especially blood thinners. Many seniors take medications such as blood thinners, warfarin or Coumadin, or drugs for heart, kidney, or blood pressure issues. Vitamin K2, although a vitamin, can affect blood clotting. Taking a D3+K2 combo pill without understanding potential interactions may influence how your medications work, which in some cases could change your risk of clotting or bleeding. This isn't just theoretical. The Mayo Clinic notes that vitamin K can reduce the effectiveness of warfarin. Sudden increases in vitamin K intake, including from supplements, can alter how blood thinners work, which is why combo pills should be used with caution for people on these medications. It's not only blood thinners. Some diuretics, heart medications, or kidney-related drugs may also interact with this combo, particularly when higher doses of D3 are involved. For seniors who are often taking multiple medications, these interactions can add up over time. Here's a helpful guideline. Natural doesn't always mean harmless. Vitamins act like hormones in your body, and they can amplify or interfere with your medications. Taking a few minutes to review your supplements can help reduce potential risks and support heart, kidney, and bone health. Before making any changes to your supplement routine, please consult your healthcare provider. To keep improving your health and getting the most from your supplements, watch the next video. Every tip can make a real difference. And so make sure to subscribe and get more tips to keep your health on track every day.